everybody, Tim Wine here, clinical specialist. I am here today with Stacy Michael, certified lymphedema therapist. Today we're going to shoot a video kind of playing off of some liposuction, some post-surgical content that we've done in the past, which is lymphatic drainage. What is it? Is it important? How do we know we're getting the right type of treatment or therapy or lymphatic drainage for this? So we brought in the big guns today. Stacy, how you doing today?
Great.
Very good. Hey, thanks for doing the video. So Stacy is part of our team, of our total crew of clinical clinicians here. One of Stacy's credentials is that she is not only a certified lymphedema therapist, she's also a licensed occupational therapy assistant, and her specialization is in MLD, which is manual lymphatic drainage. Stacy is also post-certified, where you're not only a certified lymphedema therapist, but you're actually a ACLS plastic surgery specialist on top of being a lymphedema therapist. So we brought out the big guns today. We're not playing around, guys. We're doing real good content on really important stuff. So we thought we'd share that with you. So let's tell everybody about lymphatic drainage. So Stacy, is lymphatic drainage important in kind of your description of what it is? What is it and why should patients get it?
Okay, lymphatic drainage is important because it helps, the lymphatic system helps to control fluid buildup in the body. So, for example, if you have any kind of surgery or post-surgery, or even patients who have went through cancer and get any kind of lymph node removed, it's important because those lymph nodes are damaged and the fluid needs to be rerouted to leave the body. So that's where lymphedema comes in, where we reroute the fluid to other parts of the body so it can be drained.
Perfect. And the importance of that is this incorporates so many different aspects. It means women who have had breast cancer with lymph node removal,
Yes.
right? It means patients who have had orthopedic surgery, neurological surgery. Within the scope here of our discussion today, this is extremely important for women who have had breast augmentation, tummy tuck, liposuction, facelift, and breast augmentation, whether it's reconstruction or even elective. The importance of removing the fluid that Stacy mentioned is because surgery is like a big thunderstorm blew through our bodies, and the drains in the sewers that are meant to wash all the debris in the water away from the storm get clogged up, and when the storm drains get clogged up, then all kinds of stuff happens.
Yes.
Bacterias, hematomas, seromas, our scars look worse, our scars get raised, and in the case of liposuction and other cosmetic procedures, it's the dreaded liposuction fibrosis. Fibrosis being lumps, bumps, those little dips, those hard knots. And I guess that's the first part of our discussion, is really busting myths on lymphatic drainage. So number one, what do we hate to call lymphatic drainage? We hate to hear it called lymphatic massage, right?
Absolutely.
Because it's not a massage. Describe for everybody how it's not a massage and how it's just very light, and how most people who get lymphatic drainage are probably like, oh, you're not even doing anything, are you?
But lymphatic drainage is not a massage, therefore you don't go deep into the tissue. It's just light techniques. I don't want to say the word massage, it's just techniques. We have different techniques that we use to move the skin superficially, to move the fluid. Because we have the deep lymphatic system and the superficial lymphatic system.
And it's very light, right?
Yeah, very light.
Anybody who sees true lymphatic drainage done, this is a very light touch across the skin in which we move fluids to different areas, and it's that movement of fluid that is the key to healing and success. So things that we see is tummy tucks and liposuction to the abdomen. So your doctor does liposuction to your abdomen. They put you in a compression garment, but the garment doesn't fit right. It's too tight. It's too loose. We get this pocketing of fluid, and it's the fluid that actually turns into almost like a acid that causes the tissue to turn into fibrosis. So let's talk about that. Number one, bullet point, lymphatic drainage does not treat fibrosis. Lymphatic drainage is used as a pre-fibrosis tool to keep that lumpy and bumpy from happening. So anybody out there watching this who says, well, my surgeon or I went online or somebody said I should go get lymphatic drainage, if you already have the lumpy bumpy, the hard lumps and the knots, whether it's your face, your abdomen, or other areas, that's where we come in as the Aspen Center, providing a treatment specific to fibrosis. More importantly, though, we want to prevent that from happening. So this is where anybody watching this, call us, email us, DM us, whatever. We'll connect with why Stacy and our clinical team is so important, because we want to see you immediately after surgery, typically within a couple of days, no more than weeks, to be able to get you true lymphatic drainage to not get the fibrosis and some other things.
Within 7 days.
Perfect. Yeah, it's a magic window. I tell everybody it's kind of like concrete. Imagine your surgeon is forming you out of clay or concrete, and you have a very limited amount of time to be able to shape your body the way you want it to before that concrete hardens. So as Stacy said, within 7 days, that's a magic window of being able to start, because if you wait too long, then the concrete or the clay hardens, and then now you're stuck with lumpy and bumpy. Not that that can't be treated, but it's very important to start very early. Other components of lymphatic drainage is infection, right? So your experience with lymphatic drainage and addressing hematomas, seromas, and infections, what would you say, how does that impact those things with lymphatic drainage?
Well, if the fluid remains in the body, then where does it go? It stays in the body, stagnate, and it becomes an infection, the skin, because it has to go somewhere. Sometimes it gets so swollen, the skin actually bursts.
Right.
And that's where, if the skin is burst, then it's an open door for infection to get in.
Bacteria comes in.
Exactly.
Infection festers in that fluid that we're trying to drain.
Exactly.
Seromas create bacteria environments. Hematomas, which is, blood pockets, create bacteria. So the goal is get rid of it.
Exactly. Yeah, so you want to, practice prevention, early prevention. You notice the issue or the problem, you start on it right away.
Right. And I think another topic that we probably don't talk a lot about, I think the community of surgical and post-op care, is the importance of compression garments, right?
Yes.
So in our environment, whether we're doing lymphatic drainage for true lymphedema patients, right? So leg lymphedema, lymph node removal, arm lymphedema, which is really more medically oriented. Even in the cosmetic side, proper fitting compression garments are super key. So not only are we pushing the fluid out that causes the healing and the better environment, but we have to wear a good compression garment. So one of the bonuses really of initiating an Aspen treatment is you have experts like Stacy and the rest of our team being able to look at your compression garments. Are they properly fitted? How many garments do you need? Discuss things like how after tummy tuck or liposuction to the abdomen, we discourage you from wearing that white Velcro binder unless it's temporary for, let's say, a drain tube or an incision, but not long-term. And we'll go over all of that. So anybody with any questions, give us a call. Take a look at the 877 number on the banner below. DM us, call us. We're here to help. We do offer virtual consultations where anybody who has a question from anywhere in the world, we can do a virtual with you, take a look at you, look at how you look at your problem, give you some counseling, and talk about what your resources are regarding where do I get treatment? Do I know I'm getting the right treatment? What's the cost of the treatment? And we're here to help. So thank you, everybody. Stacy, thank you so much, and we'll see you guys on the next video.